The major cause of death in the modern world is various types of vascular diseases, of which the most prevalent form is atherosclerotic heart disease. Recognized causative factors of this disease are smoking, stress, and diet. Atherosclerotic disease is treatable through medication or surgery. Hyperlipidemia is the most prevalent indicator for susceptibility to atherosclerotic heart disease. It represents elevated plasma levels of lipids that are usually in the form of lipoproteins. Hyperlipidemia may be caused by diseases related to liver, kidney, pancreas, or thyroid, or it may be caused by any unrecognizable disease. In recent years, lipids have been implicated in the development of atherosclerosis in humans. Atherosclerosis refers to the buildup of fats, cholesterol, and other substances in your artery walls, which is also known as plaque formation. Plaque can restrict blood flow or can burst, triggering a blood clot. Although atherosclerosis is often considered a heart problem, it can affect arteries anywhere in your body. Now, anti-hyperlipidemic agents are a diverse group of pharmaceuticals that are used in the treatment of high levels of fats such as cholesterol in the blood. They are called lipid-lowering drugs. Classification of anti-hyperlipidemic agents includes several categories. These categories are: first one, HMG coenzyme reductase inhibitors. Drug candidates in this category are lovastatin, simvastatin, metastatin, atorvastatin, etc. Second category is fibric acid derivatives. This category includes clofibrate, fenofibrate, ciprofibrate, etc. Third category is bile acid sequestrants. This category includes cholestyramine and cholestyramine. Fourth category is LDL oxidation inhibitors. It includes probicol. Fifth category is pyridine derivatives. This category includes nicotinic acid and nicotinamide. Sixth category include cholesterol absorption inhibitor azacitidine. Now, last category is of miscellaneous agents. It includes beta-sitosterol and dextrothyroxine. In this slide, you can see structures of clofibrate, which is a fibric acid derivative, lovastatin, HMG coenzyme reductase inhibitor, cholestyramine, which is a bile acid sequestrant, and cholestyramine, bile acid sequestrants. Next is mode of action of anti-hyperlipidemic agents. First one, mode of action of HMG coenzyme inhibitors. Drug belonging to this category act by inhibition of HMG coenzyme as well as increase in LDL receptors. Now for understanding this mode of action, we will understand this mode of action by following diagram. HMG coenzyme is a 3-hydroxy-3-methyl-glutaryl coenzyme A reductase. This enzyme facilitates rate-limiting step in cholesterol synthesis. Inhibition of this step will stop cholesterol synthesis. Now, depletion of cholesterol causes the cell to increase the number of specific cell surface LDL receptors that can bind and internalize circulating LDLs. Thus, the end result is a reduction in plasma cholesterol. LDL is a low-density lipoprotein, sometimes called as bad cholesterol. It makes up most of your body cholesterol. High levels of LDL cholesterol raise your risk for heart diseases and strokes. Next is mode of action of fibrates. Drug candidates belonging to this category are effective in lowering serum level of LDL cholesterol, triglyceride, and increase in HDL. Here HDL stands for high density lipoproteins. It is sometimes called as good cholesterol because it carries cholesterol from other parts of your body back to your liver. Your liver then removes the cholesterol from your body. Drug candidates belonging to fibrates binds to peroxisome. Drug candidates belonging to fibrates bind to peroxisome proliferator activated receptors that regulate lipid metabolism. Fibrates binding to these receptors result in reduction of concentration of LDL cholesterol, triglyceride by increasing the expression of lipoprotein lipase. These drug candidates are used in the treatment of hypertriglyceridemias, which denotes high blood levels of triglycerides, the most evident fatty molecules in most organisms. Here is the summary of complete mode of action. Next is mode of action of bile acid binding resins. Cholestyramine and cholestyramine have significant LDL cholesterol lowering effect. Although the benefit is less than those observed with statins. These agents are resins that bind to bile acid in the intestine, forming insoluble complexes that will excreted in the feces. Lowering bile acid level will trigger the conversion of cholesterol into bile acid, and the end result will be the reduction in cholesterol concentrations. Last one is mode of action of cholesterol absorption inhibitors. Drug candidates belonging to this category produces inhibition of intestinal absorption of dietary and biliary cholesterol in the small intestine, which results in an increase in the clearance of cholesterol from the blood. Thank you.